And to legislature, President of the Senate Godswill Akpabio has announced the names of the majority leaders of the 10th Senate. The majority leaders who emerged by consensus are Senator Okpeyemi Bamidele as majority leader, Senator David Umahi, deputy majority leader, Senator Muhammad Ali Ndume, Senate Chief Whip, while Senator Lola Ashiru is deputy majority whip. Also, the Senate President has approved the minority leadership of the 10th Senate, consisting of Simon Madkon, Senate Minority Leader, Oyewumi Olalere, Senate Deputy Minority Leader, Darlington Wokocha, Senate Minority Whip, and Rufai Hanga, Senate Deputy Minority Whip. The Senate today resumed plenary after 2 weeks of break. And to education, the Joint Admissions and Matriculations Board (JAMB) says it has withdrawn the 2023 UTME result of Ejikeme Joy Mesome and also barred her from sitting the board's examination for the next 3 years. The board said this in a statement signed by its head of public affairs and protocol, Fabian Benjamin, where it restated its earlier position that the UTME result being paraded by Ejikeme Joy Mesoma is patently fake, as the candidate simply falsified a copy of a result slip of a candidate named Asimiyu Miriam Omobalanle, who sat the UTME in 2021 and scored 138. Consequently, the board would like to reassure Nigerians that its system was neither tampered with nor compromised, while reassuring Nigerians that its system was neither tampered with nor compromised. The board notes that the QR code extrapolates the UTME result of each candidate. Hence, what is on the results sheet is nothing other than the interpretation of the information on this QR code. The board also says it's not adverse to public scrutiny and is ready for open public session involving the agency as well as relevant security agencies, where the candidate's parents, guardian, and her legal team will be present. A search and rescue operation by disaster and emergency responders continues at the site of a collapsed 4-story underground building at Cafe Dape Life Camp Abuja. Our correspondent Onotu Yakubu joins us from the location of the collapsed building for an update.
The machines are still in overdrive and manual efforts are still on also by these search and rescue team members to dig through the underbelly of the collapsed structure. Of course, their target is to ensure that they ascertain the safety of everyone that might have been here when the structure went down yesterday. And that has been on, as it started since last night, it has been sustained up till this morning. Of course, at the early hours of the morning, there was a shower in the Federal Capital Territory that to a little extent delayed the operation, but the moment the rain subsided, the operation resumed, and then all they've been doing all through here, in fact, from the 4 walls of this collapsed structure, what you see are this ongoing operation from across the 4 walls of the structure to ensure that they dig through and then bring the entirety of the rubble here down, move the boulders off the collapsed structure to ensure that all the victims, if there are any victims trapped underneath the rubble of the structure, are rescued and ensure their health and safety.
Some of them normally come to stay in uncompleted buildings like this, and that is why the search is still on. Operation will continue until we get to the basement of this building and we are sure that no one is trapped. That is when we now call the operations off.
As a last night's update of this ongoing rescue operation, we confirmed that 9 victims that were trapped underneath the rubble had been successfully rescued, and 4 of them that were injured were immediately taken to the hospital for first aid and medical attention, and they returned here to join us before our team departed this place last night. So there's been no further update as to the figures of the number of rescued victims, it still stands at that 9 that were rescued yesterday.
Excavation is ongoing, and our men are on ground in case there's going to be any people rescued alive. We can give backup, we can give support.
What I've been able to confirm from members of the search and rescue operation as to what might be the immediate and remote cause of the collapse of the structure is that the environment where we're standing is actually compromised. The area is a waterlogged. In fact, from just across the wall of this structure, this elevator cast behind me is basically like the bank of the river. For now, that's what has been established as to what might be the remote cause of this collapsed structure here. That's the update from the search and rescue operation ongoing here.
Thank you very much, Onote Yakubu, for that update. A report just reaching us now says Speaker House of Representatives Tajuddin Abbas has announced principal officers of the 10th House as of the Green Chamber reconvened Tuesday after a 2-week break. The principal officers are House Majority Leader Julius Egwevere, House Chief Whip Usman Bello Kumo, House Deputy Majority Leader Abdullahi Ibrahim Halims, House Deputy Whip Adewumi Onanuga, and that full report will come up in our subsequent bulletin. Moving on, the Director AEPB Engineer O.C. Brima says the sewage plant in the FCT is fully functional and designed to meet the required standard. He said this while refuting claims that the agency is exposing FCT residents to sewage toxins. Aisha Bashir has the details.
The Director, Abuja Environmental Protection Board, O.C. Brima, in a facility tour with other stakeholders around the sewage system treatment plant, says maintaining proper hygiene in the FCT has been their top priority over time. He explained that routine maintenance is usually carried out on the plant, and that is what members of the public were mistaken for toxins.
As you can see, the plant is fully functional, well maintained, and there's no discharge of raw sewage anywhere in the Federal Capital Territory. So there was never a time it was shut down for 6 months, and that will really be the height of irresponsibility to shut down such a critical infrastructure for 6 months. So it's even hard to believe that that will occur.
He assured FCT residents that the mandate of the Abuja Environmental Protection Board will not be compromised.
No panic at all. There is no discharge of raw sewage anywhere in the FCT. The sewage coming out of this plant is treated, and I'll also take you to the discharge point at the back of the plant. So you follow the processes of treatment from the beginning to the very end.
O.C. Brima called on the public to disregard such information as it is false, urging FCT residents to collaborate with the agency in maintaining a healthy environment. Aisha Bashir, Nta News.
Meanwhile, as Nigerians seek access to quality and affordable health care, is the introduction of the National Health Insurance Scheme is expected to help achieve universal health coverage. For reports on benefits of the scheme,
meet Simon Ode, an on-air personality with an Abuja radio station. Mr. Simon, a father of 4, has his family enrolled under the FCT Health Insurance Scheme. He expressed his relief that when it comes to access, he has no worries.
It's just like what I started with that waste of a team, which I should have spent roughly 150,000. But I did not pay that money. It should have come from my salary, or maybe I should have gone and look for money to pay. So now, because I'm there, I did not pay those money. You see, so it should have been a very big challenge. And for a woman to go under CS, you know, it's not an easy thing. Some places, if not because I'm an enrollee, I think I should have paid up to 80,000. My second daughter have an issue with her. It was being taken care of.
This puts Mr. Simon off the list of many who have to do out-of-pocket spending for health services, which most times leaves the average and vulnerable Nigerians in penury, a situation the health insurance seeks to address.
It covers most of the reasons why anybody will go to the hospital. More than 80% of conditions that take you to the hospital, things like basic surgery, cesarean section, appendicitis, fibroid, they are all covered. And you can even have opportunity for secondary care services. The scheme is open for everybody. And not only open for everybody, it also seeks to address the challenges of the poor and vulnerable, those that cannot pay for this service.
However, despite the enormous benefits of the health insurance scheme, it is yet to get a legal backing for its operations in the FCT as a state.
When you look at the number of lives that are registered with the FCTHIS, it's considered one of the best in the country. But overall, among the 6 cardinal pillars of the health system, I believe health financing now should be critical, because where you don't have financing, despite capable leadership and governance structure, you will not be able to achieve much.
It's worthy to note that the National Health Insurance Scheme NHIS Bill provides a policy framework for the establishment of the FCT Health Insurance Bill. Although it has been passed by the National Assembly, it is still awaiting assent, a development many believe will bring about an effect